Utilization review and case management are often talked about like they are the same thing, but they are not always the same role. And if you are a nurse looking at jobs beyond the bedside, understanding the difference can help you avoid applying for a role that does not actually fit what you want. Because on job boards, the wording can get confusing. You may see case manager, utilization review nurse, utilization management nurse, care coordinator, discharge planner, prior authorization nurse, or even a role that combines several of those responsibilities into one position. So today, let's make the difference simple. Case management is usually focused on coordination, planning, support, education, and helping the patient move through the healthcare system safely. Utilization review is usually focused on reviewing whether a service, admission, procedure, or level of care meets certain clinical criteria. That is the simplest way to separate them. Case management asks, what does this patient need and how do we help coordinate the next step? Utilization review asks, does this care meet the criteria for this setting, service, or level of care? Both roles use nursing judgment, but they use that judgment in different ways. Let's start with case management. A case manager may be helping with discharge planning, care coordination, patient education, transitions of care, resource connection, follow-up needs, and barriers that could affect the patient's safety after leaving a setting. For example, a patient may be medically ready to leave the hospital, but they need home health, durable medical equipment, transportation, medication support, or placement at a skilled nursing facility. A case manager is looking at that whole picture. What does the patient need next? Who needs to be involved? What barriers could delay or complicate the plan? What does the patient understand? What support do they have at home? That role often requires a lot of communication. You may be talking with providers, bedside nurses, therapy, social work, families, patients, insurance companies, facilities, home health agencies, or community resources. So, case management tends to be very coordination heavy. Now, utilization review is different. A utilization review nurse is usually looking at the clinical documentation and comparing it to guidelines, criteria, payer requirements, or internal policies. The question is not only, does this patient need help? The question is, does the documentation support the requested level of care or service? For example, a patient may be in the hospital. The utilization review nurse may review the chart to determine whether inpatient status is supported, whether observation status is more appropriate, or whether continued stay criteria are being met. In another setting, a utilization review nurse may review a request for skilled nursing, rehab, home health, imaging, surgery, or another service to determine whether it meets medical necessity criteria. That does not mean the nurse is making random decisions. Utilization review is usually tied to specific criteria, policies, payer rules, and documentation standards. So if you are the type of nurse who enjoys chart review, clinical reasoning, guidelines, documentation, and looking closely at whether the record supports the request, utilization review may be worth exploring. But if you are the type of nurse who wants more direct patient or family communication, more care planning, and more hands-on coordination, case management may feel like a better fit. Now here is where it gets tricky. In real life, these roles can overlap. In some hospitals, an RN case manager may do both discharge planning and utilization review. They may attend rounds, coordinate discharge needs, communicate with families, and also review medical necessity or patient status. In some insurance companies, a nurse may have a title that includes case management, but the day-to-day work may involve a lot of utilization management, authorizations, or reviewing requests. That is why the job title alone is not enough. You have to read the responsibilities carefully. If the description says care planning, patient outreach, education, barriers to care, transitions of care, follow-up, and resource coordination, the role probably leans more toward case management. If the description says medical necessity, clinical criteria, authorization review, concurrent review, continued stay review, level of care, denials, appeals, or utilization management, the role probably leans more toward utilization review. And if the job description includes both sets of words, then it may be a blended role. That is not automatically a bad thing. Some nurses like blended roles because the work feels varied. You may spend part of your day reviewing charts and part of your day coordinating care. Other nurses prefer a clearer lane. They may want either patient-facing coordination or more behind-the-scenes review work. Neither choice is wrong. The goal is to understand what kind of work fits your strengths. Let's talk about the skills that transfer from bedside nursing into both roles. For case management, bedside nurses often bring strong assessment skills, communication skills, discharge awareness, patient education experience, and the ability to notice when a plan may not work in real life. That matters because case managers are often thinking beyond the immediate moment. They are asking what the patient will need after this visit, after this admission, or after this transition. For utilization review, bedside nurses bring clinical judgment, chart interpretation, understanding of patient acuity, and the ability to connect documentation with the patient's actual condition. That matters because utilization review often depends on whether the clinical picture is clearly supported in the record. A nurse who has worked at the bedside can often understand the seriousness of a situation quickly. But in utilization review, the key question becomes, is that seriousness clearly documented? That shift can take time to learn. At the bedside, you may know a patient is very sick because you saw them, assessed them, and watched their condition change. In utilization review, you are often relying on what is written in the chart. So documentation becomes very important. If the chart does not clearly show why a certain level of care is needed, the review may not support it, even if the situation felt obvious to the care team. That is one reason utilization review nurses have to be detail-oriented. They need to understand the clinical picture, but also how to read the record carefully and apply criteria consistently. Case managers also need strong documentation, but the focus may be different. They may be documenting care plans, barriers, outreach attempts, patient education, discharge needs, referrals, family conversations, and progress toward goals. So both roles document, but the purpose of the documentation may be different. Now, if you are deciding between these two paths, here are a few questions to ask yourself. Do you enjoy talking with patients and families, or do you prefer more chart-based work? Do you like coordinating resources and solving practical barriers, or do you like reviewing clinical information against guidelines? Do you want a role that is more communication-heavy or one that is more review-heavy? Do you feel energized by helping someone understand their next step, or by analyzing whether the documentation supports the level of care? Your answers can help point you in the right direction. It is also important to ask good questions in an interview. You can ask how much of this role is care coordination versus utilization review. Will I be speaking directly with patients or mainly reviewing charts? What criteria or guidelines does the team use? Is this role responsible for authorizations, denials, appeals, discharge planning, or all of the above? What training is provided for nurses who are new to this type of work? Those questions are practical. They help you understand whether the job matches what you think you are applying for. The biggest takeaway is this: case management and utilization review are related, but they are not identical. Case management is usually more focused on coordination, education, care planning, patient needs, and transitions. Utilization review is usually more focused on criteria, medical necessity, level of care, authorization, and whether the documentation supports the requested service or setting. Both can be meaningful paths beyond the bedside, but they fit different strengths, different work styles, and different career goals. So before you apply, slow down and read the job description carefully. Look for the words that tell you what the role actually does day to day. Then ask questions in the interview so you know whether the position is case management, utilization review, or a combination of both. The clearer you are before you accept the role, the better chance you have of choosing a path that actually fits the kind of nursing career you want next. And if one of these careers interests you, Case Management Institute can help you take the next step. For nurses exploring case management, we offer education designed to help you understand the role, develop practical skills, and apply your bedside experience in a new setting. For nurses interested in utilization review, our UM and MCG Fundamentals course teaches the foundations of utilization management and includes hands-on practice using MCG's CareWeb through realistic case simulations. Whether you are considering case management or utilization review, you can explore our training options through the link below and find the path that best fits your career goals.